to say something?
Yes.
I'm Sylvia Hubbard. I founded MACA because nobody was doing anything in the black communities around HIV/AIDS. I've been doing it about 25 years. We have an office in Hudson and one in St. Petersburg. We're looking for patients, and they don't have to be HIV positive. They just need to come see a doctor because we don't do it. Collaboration is key. I just gotta look at Jewel because she started this whole collaboration thing in Hudson, in Newport Richey. She got it flaming. It's been what, a year, 2 years?
It's a year. Has it been a year?
It's over
A year and a half? Maybe?
Yeah.
I've only been here a year and a half in this
Yeah,
county.
it's over a year. And she's got that flame going.
You went over,
Thank
but
y'all
it's
for
okay. The boss can never go over.
Did I go?
No.
Okay, let's go.
Grand Rising family. My name is Rose Harnado. I am the Regional Prevention Manager for Can Community Health. I oversee the prevention efforts out of 5 clinics in 4 counties. So we cover Palmetto, Newport Richey, St. Pete, Clearwater, and Tampa. I've been with them for about 3.5 years now, and our team of 3 now is out in community 5 days a week, offering mobile testing for pretty much all high impact areas. So.
Okay, good morning, everybody.
Good morning.
My name is Aleacia Guy. I live in Newport Richey. I'm a retired nurse, and I've known Candace since, I would guess to say maybe 2015. Because she came to the African American Club and she just jumped right in to help me do certain things. And I said, this is somebody that I need to stay in touch with. And her children came to the after school program, and she invited me here today to speak to you guys. So thank you.
Beautiful, beautiful, beautiful. So now that we've got the introductions out of the way, I do want to call our first presenter. But first, I was going to tell you a little bit about MACA and some of the things we're doing out in Hudson. And so basically, we're trying to get out into the community to let people know that we're there. Like Sylvia said, we're taking in new clients. We're looking to collaborate with organizations such as Amazing Grace Wellness Center. They've now created a referral program for us to be able to handle the clients that come in to them that may need testing or additional services in that area. And so we're looking to team up with more organizations to do that. We're also going to be having monthly events. You have a flyer on your table that shows our next event at the end of this month. So this meeting is basically to partner up for that event. If this month we're tackling minority health and the disparities that come with that. So if within your organization, such as Ms. Jewel, she's a presenter, her organization, but Jen, which is a new person within her organization, will be doing her presenting at that event. And Amazing Grace Wellness Center will be providing health screenings. So if you have something along that line for this month, we can team up.
Yes.
And so each month we'll be tackling another community, and we're coming up with a new way of trying to get to the community. This event may be the last event that we do in the walls. We want to get to the community, so me and Miss Ann Williams, MACA, we teamed up with other organizations and businesses to do the parking lot project.
Okay, tell us about that.
Yes, so basically we'll be headed to different businesses in the community that supported us. We go out every month leaving things like this that you'll see on your table. Bigger organizations such as You Shush, who go out and talk to families about difficult conversations. She can take things like this with her, and she met a group of young men and had this on hand to give to them, plus some resources from us to say, if you need testing, you want confidential testing, come to us. We can do that. So We also leave things like this at the barbershop, the beauty salon, so that people can pick it up. Some organizations and businesses allow me to go in and give talks, just random, and we get some good conversations going, and people that maybe have been afraid to know their status get tested, which is the point. So that's more, we're gonna be at those businesses. They're allowing us to come out and come together as a collaborative effort with the community. We wanna invite people, organizations to join us. So that's up and coming. All right, so thank you. After all of that is being said, I do want to introduce the lovely Miss Ann Williams. She is a Jackie of all trades, and I did meet her in the community, and our relationship, business, and friendship has blossomed. She's helped me improve in a lot of areas, and I pray that I've been a blessing into her life. She's utilizing her medical field and skills to work with Amazing Grace Wellness Center, and we've gotten the referral program started. So she's here to talk about that, as well as some of the health disparities in the community.
So before I do that, I'm gonna piggyback off of what Candace said. It's almost like if you get tested, you die right now.
Mm-hmm.
So the information and the education behind it's not a death sentence. It's not the end of the world. You're supposed to know. If you know, it can prevent further. Like, she does that. And the conversations at the barbershop, in the beauty salons, they definitely, they're a hard bargain. Like, and I think sometimes it's because they're around other people and they don't want to be vulnerable in front of people. But they ease it. Candace so soft spoken. They ease into it, and then it's like they have an epiphany. So they have that aha moment, like, oh, you're right, maybe I should. Okay, and then you get through, but each one teach one. So if I come and I tell you, now you can go and tell somebody else. A lot of the men at the barbershop didn't even know that you can get STDs more than just in your mouth and in your vaginal area. You can get it under your armpit, anything that's porous. So just having those conversations means everything. So that's kind of how she penetrated the surfaces on that part. But with Amazing Grace, we are able to come out and do health screening. So the health screening would consist of checking for the blood sugar levels, checking the blood pressure, temperature, the pulse, the O2, which is basically your oxygen level, how good you're breathing or not breathing. And then to give some education like on diabetes. A lot of times they tell us that diabetes is hereditary. Well, honestly, nothing is hereditary.
Amen.
All right.
Amen.
Yep. Nothing is hereditary. And there are ways to prevent and to cure yourself of these things. But you have to have somebody that care about that. Like, and not just, oh, let me give you these pills and give the pharmaceutical company some money. It's other things you can do outside of that, like your eating habits, that type of thing. So that's what we do when we come out into the community, or come out to the events, and yeah.
So next we have our speaker for today. We had a few people come in. Thank you so much. Be prepared to introduce yourself right before lunch, just saying. We got to get to know each other. So, Miss Aleacia Guy, I want to say a few words first. I did meet her at the African American Club. She was one of the first women that I met, and she took me under her wings and introduced me to people. She's the reason I'm here, because she took a chance on me. I was doing different things, my magazine printing. She connected me to people, put money in my pocket and for my family. So that's the reason I called on her when she said something about her sorority and nurses. I said, that's right. You're coming to speak here next week, last minute, and she's here to do it. And I thank you and I appreciate you. So.
Thank you. Okay, so a little bit about me. I have graduated from a nursing school. So I started out with an RN diploma. you can get a RN diploma, you can get a BSN, you can get a MSN. So I started low because when I started school, I was like 30-something, nursing school. I was 30-something, so I had to do it the fastest way I could at the time. And then I went to St. Peter's College in New Jersey and got my bachelor's degree. And then I went to LIU in New York and got my master's in public administration. And then I finally retired in 2014. Yes. And then I moved to Florida in 2015. Okay. I am a member of the AAC Club. I'm a member of the National Organization for Women, which is, I'm the treasurer there. Pasco Democratic Party, and the League of Women Voters, and a member of Chi Phi Sorority, which is a black nurses sorority. Their colors are green and yellow, as you can see. And this is my membership. And they are based out of New Jersey. So I maintain my membership with them because nothing's really going on with that in this part of Florida. And Florida it looks small on the map, it looks narrow on the map, but it's really spread out. So I had a hard time getting nurses to start a chapter here.
Mm-hmm.
So I said, I'm not gonna go there anymore. With all the other organizations I'm involved in, that's enough right now. And so currently, not currently, but in the last year, I became the president of the Black Caucus for Pasco County. And I was really excited about starting that because that's what we need. We need black people to know what's going on politically as well as health-wise, okay? So my motto is, a body in motion, state in motion. So that's what I'm doing. So we wanted to address healthcare disparities, but that's been on the plate for us to address forever.
Yep.
And MACA is just the modern day effort to do something about healthcare disparities. So W.E.B. Du Bois, born in 1868, he's the first person that said hereditary has nothing to do with black disabilities or black healthcare. He's the first one, 1838, he was born. In 1908, the National Association of Colored Graduate Nurses started, and they were committed to advancing healthcare in African Americans. That's 1908. In 1932, Chi Phi Sorority was started, and we were started because the American Nurses Association, all-white organization, would not allow black nurses to join. So 12 nurses decided to start their own, and that was in 1932. And from that point on, we have always been involved in community service, okay? Service for humanity is our motto, and we go into different communities and we do health fairs, blood screening, finger stick blood sugar, healthcare about diabetes. We have kidney month. We have heart health month. So they're very active. It's just I'm not active here, but so this is my good substitution. In 1957, we had the Civil Rights Act, which we thought was going to help us with disparities. 1966, you had the Black Panthers. Now, how many people know about the Black Panthers? And how many people say that, oh, they were political? Were they more than political?
Yeah, because
Right.
I heard they was all in the community.
Yes,
feeding
they
people,
had-
doing all
They, in
that stuff.
1970s, they
the WIC
developed
program.
free programs, free clinics, ambulatory services, because they knew what we needed. Okay, so even though they were political, they still dealt with the community and healthcare disparities as well. In 1971, you had the National Black Nurses Association, and they were established to address healthcare needs as well. So, what I want the people to do, black people to do, is stop, look, and listen to what your body's telling you.
Yeah.
So sometimes you gotta look in the mirror, stop, and say, okay, my breasts are not even, okay? Something's wrong here. They were even, but they're not even now, okay? Or you gotta look and say, one eye is red and the other eye is not.
Yeah.
Or you gotta look and say, oh, my stomach got so big. How did that happen? You know, you got to stop and look at yourself. Look at yourself and listen to what your body's trying to tell you, okay? I'm talking about a good bowel movement. How often? Every day, every day, okay? Your bladder issues, do you get up several times during the night to go to the bathroom? That means that your bladder is not emptying. So you need to find out why it's not emptying. And that might be an issue you could talk to with your doctor. Now I have a medication sheet here that I'm gonna leave with, Candace. And it's, what is it? And it's a list of, I don't know if I'll find it. It's a list that you can take, that you can make with your doctor, to talk about, I'll show it to you, to talk about, make sure you make a list of what you wanna talk about before you go to the doctor. Because when you get there, sometimes you're like a little intimidated because they come rushing in, the nurse comes rushing in, so you don't have time. So they say, well, how you doing today? Just take your list out and go one by one until you're satisfied with what they say. Hearing difficulty, untreated, okay? If your hearing is, you know that you can't hear. Why? Because you keep saying, what did you say? Or you keep saying, what did they say when you go to a conference? Or you keep saying, I didn't hear what you said at all, turn your head around. That means that you're having hearing difficulties. Now, hearing difficulties can lead to dementia, okay? Because you're not in contact with the world, okay? It can deprive your sounds coming from your brain or coming to your brain, okay? It's brain deprivation, that's what they call it, because you can't, your brain is not syncing up. And then it causes depression, because you get kind of depressed when you feel like, I can't hear, so I'm not going. So you're depressed about that. It's like a circle. And it's the risk for falls, because you don't necessarily hear what's going on. So what causes it? Our age, of course, okay? Infection, environment, and some medication as well. So, and then you need sleep. So listen to yourself. You're yawning all day, you have got to get more sleep, okay? Sleep is everything. Nutrition awareness is important. Find some kind of exercise. We don't like to exercise, however, the simple exercise is marching in place, okay? Or sitting in your chair and bringing your legs up. But major exercise is finding a swim program or aerobics class. We're in Florida. They like to play in the pool, okay? It's exercise. So find something that you can do every day on a consistent basis, or at least 3 times a week, at least, okay? Bone density and nutrition awareness. We need to know what's good for our bodies. How many milligrams of salt is it? How many milligrams of sugar is it? We need to know the difference, so you need to read the labels, okay? Bone density, we need to have a bone density test after a certain age every 2 years. So when you talk to your doctor, simple question, is it time for me to have a bone density test? Okay, that's a simple question. And by all means, get vaccinated. Flu vaccine, COVID vaccine, RSV, pneumonia, shingles. Those are all stuff that we should have. Now, how many people know about cortisol? Cortisol, okay. Cortisol can be elevated, and most of the time it's elevated when we have stress. And I say we because African Americans have a lot of stress. So our cortisol can always be elevated. Does anybody know what that means, to have an elevated cortisol in your body? Oh, the impact of it?
Something about high blood pressure, I believe.
Everything, okay. So the impact of high cortisol is hypertension, weight gain, anxiety, diabetes, osteoporosis, constipation, headaches, fatigue, heart disease, sleep disorder, and poor communication. And that's only a few.
So that's what's wrong?
That's what's wrong with it. Exactly. Because the more cortisol we have, the more stress we have, the higher the cortisol. And that cortisol can affect in different parts of your body. Okay, so let's talk a little bit, if I have more time. Let's talk about hypertension, CKD, which is chronic kidney disease, and diabetes. So I have your blood pressure stages right here. I can get this, Candace can make a picture and send it to everybody. But a normal blood pressure is 120/80, okay? And that's still in the literature. If your blood pressure is elevated, it could be anywhere between 120 and 139. If you have high blood pressure, it could be between higher than 140. And that is, when you go to the doctor, the nurse or the medical assistant takes your blood pressure and they write it down and say nothing to you. The important thing for you is to say, what was my blood pressure? Put it in your phone, put it on your piece of paper you brought, but know your numbers, know your own blood pressure, okay? Kidney blood work, they have 2 tests that you can really do for kidney blood work, and you can say to the doctor, I wanna test my kidneys. My father, I have a history of it, or whatever. And they might say, no, you don't have to. Say, well, you know, I just wanted to do it if I could, okay? As long as you don't have to pay for it. So your GFR, so that's your glomerular filtration rate. Your kidneys filter dirty stuff into your urine and then you urinate. If your rate is slow, that means that the kidneys are not functioning that well. So the slower the kidney, the less the filtration, okay? And the other test is, blood work is creatinine. So if your creatinine is high, that means that it's not being filtered to the kidneys. So you want those two things that you can check on. And of course, diabetes. So everybody heard of A1C?
Mm-hmm.
A1C. What is it? What is it? Okay. It's nothing but how the percentage of your hemoglobin that's sugar coated. And that's what you look at. How much sugar coated hemoglobin do I have? The greater the number, that means your diabetes is not doing that well, right? So it's just sugar coated blood sugar. So let's talk about condiments. Ketchup, good or bad? Why is it bad? Huh?
Lots of sugar.
Lots of sugar,
I
right.
want you to eat it.
Right. How about barbecue sauce? Bad or good? Huh?
It depends, is that North Carolina?
Bad.
Sweet and smoky one.
How about mustard?
I like mustard.
Mustard is good.
Oh,
Mustard is good. How about salsa?
No.
Salsa is good.
Is it?
Salsa
Yeah.
is good.
Salsa?
Mayonnaise,
No.
too much. And hummus.
Hummus
That's
is
good.
good. That's good.
Very
Wow,
good.
we should have had hummus. And guacamole.
I love
Wow.
it.
That's good. So ketchup, like you said, is too high. Barbecue sauce is high in sugar and salt. All right. Mayonnaise is high in calories and saturated fats. Mustard is low calorie.
That's
It's
the regular yellow mustard, right?
Yes.
Rather than-
It's kidney friendly. So if you have issues, if you know that your kidneys are not flushing that well, mustard is okay to use, okay? But you gotta check the sodium level in the mustard that you're using, so you check the bottle. Hummus, low calorie, high fiber, healthy fats. Guacamole, you can use guacamole in place of mayonnaise,
Yeah.
okay? It can help reduce bad cholesterol levels, all right? And lower your risk of heart disease. And they also provide nutrients that help develop and maintain your body cells, okay? Salsa, try substituting ketchup with salsa.
Okay.
And salsa is a great way to incorporate more fruits, veggies in your diet and can also provide many additional vitamins. So look for fresh, salt-free salsa, or guacamole, or make it yourself. Salsa, or make it yourself.
Yeah.
Oh, here it is. This is the medication sheet, so you can take it to the doctor. And, okay. So, this is the sheet. This is the target blood sugar. Fasting can be less than 100. This is for 20 years old and older. Before your meal, 70 to 130. After your meal, maybe 100. And this is for diabetics. At bedtime, 100 to 140, and your A1C, it should be 7 or less if you're maintaining your dietary diet. And if anybody has any questions for me, I hope that wasn't too long, right? Should 10 minutes.
I got questions. I'm happy because what I realize a lot of times why people are hesitant to even go to seminars or webinars is because they feel judged, right? In your case, you spoke to us, not at us. And you gave us a lot of information. I had my doctor's appointment yesterday, and when you said the blood pressure, that's why she wasn't worried. I was 120 over 80.
Right.
I said, what about that low number? What about that number on the bottom? Isn't it too high? She goes, oh no, you're great. But you explained
Yeah.
that it's the baseline,
Right.
right?
Yeah.
So that gave me a little, and all those other stuff you were talking about, I'm healthy, y'all.
And Michelle,
She
you should,
explained it.
I just want to add to something that you said. So, because a lot of us don't know, Y'all know that anything you put on your body or in your body, your kidney filtrates, right? Lotions,
Yeah.
everything, lipstick, eyeliner. It literally, everything that touches your body, whether outside or inside, hair grease, your kidneys filtrate or your liver filtrates. So that's something to think about too, because a lot of times we'll have like autoimmune diseases like lupus. And they're like, oh, again, that's hereditary. It's not hereditary. It's what you're doing, right? Whether outside or inside, it's environment, absolutely. So I just wanted to add that because a lot of us don't know that.
And to add to that, that's why you should not hold on to your urine.
Yes.
Okay, because you can get a UTI in a minute because you have dirty urine hanging around in your bladder. Okay, and you have to get rid of it. So when you should go and everybody knows you have to go to the bathroom most of the time, unless you have issues. But that's a very important reason to go.
If I may, I really, really appreciate the presentation today because as the lovely lady in the corner said, you spoke with us and you engaged us and you made us think about things, and so that's really important.
Thank you.
One thing that I really do emphasize when I speak to our patients as well is to encourage them to advocate for themselves because we know how difficult it can be sometimes for Black and brown folks to navigate the healthcare field. And we also have a level of distrust that we carry with us that unfortunately even in modern days we're still facing a lot of discrimination and blocking of services. And so I definitely encourage folks, because even myself, I'm a strong advocate and I face a lot of barriers navigating my own healthcare. So I can imagine folks who may not have the literacy or the strength or the esteem and they look for advocates, you know, to do that. So kudos for you being out in the community and sharing this wealth of resources and information.
So much. So I just got to say, I just got to touch bases on that because now that's hereditary. Us not wanting to talk about certain stuff because you hear your grandparents like, don't talk about that. You don't tell nobody that. So you translate that into life. So that's hereditary.
The sorority has a lot of resources, and one of the resources that I got when I went to a kidney program years ago are maps about diabetes. So in the future, maybe we can if we have some place where we can put up a map and then we can talk about it. Because there are maps on managing your diabetes, healthy eating with diabetes, monitoring your blood sugar, your journey to diabetes, and gestational diabetes. And those are all different maps. They're really nice.
Okay, I'll get all of those resources.
What is diabetes awareness month? Diabetes awareness month.
I'll look it up.
It may be September, October.
I think
but
it's
October is the rest of the
Yeah, so if we find a place, we could put the map up and
I
have a
was
good conversation.
really excited hearing you talk because you mentioned know your numbers.
November.
And last year, our agency hosted a Know Your Numbers event in our parking lot in Newport Richey, where we distributed, we were sponsored by a pharmaceutical company, so they gave us a little money. So we bought a bunch of fresh produce. We were distributing fresh produce in the community, but we invited healthcare providers that would be able to do things like blood sugar. We offered STI and HIV testing. We gave out clothing during that time. And it was it was a great event, but it wasn't well advertised. And we were brand new to the area. So hearing like that, you say that phrase again, I was like, oh, because we're talking about doing it again, but we need to be more impactful and intentional this time.
Okay, Candace, I wanna, this is a really good group, because a lot of times you go to meetings such as this, and nobody wants to participate, but then again, it starts with the speakers. Right? I would like to encourage MACA to maybe even get with Manny, I can try to push that forward, to do something for Breast Cancer Awareness Month. And a lot of, in my sorority alone, this year, I've probably about 10 or 15 Black women who've been diagnosed with, whether it be breast cancer or with, they always say African American women have dense breasts. Okay, well, if that's the case, start screening from younger, if that's the case, right? Because we'll listen, right? So I'm gonna, if you guys want me to take the lead on something like that, it will be a MACA event. Yes, Sylvia, I'm doing all my stuff, my head is spinning right now.
That's okay.
Working it together with Manny
Okay.
and try to do something like where we did it on the park, where people could come and walk
Right.
and raise money. Or,
Okay.
and then at the same time, bringing awareness to MACA.
Right.
That yes, the focus of the organization is HIV/AIDS testing, blah, 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 but we're not in a box.
Right.
There's other stuff that's going on outside of that.
Right.
Right? So
Absolutely.
you bring them into that event,
Yeah.
but then provide the education of what MACA does.
Well, and one
You
thing
wanna hurry,
people,
Sylvia? No, I'm
yes,
talking.
I have one thing, no, I'm gonna jump in where you
Yes, ma'am.
at. One thing about MACA, we don't just see people with HIV.
Mhm.
We see everybody.
Right,
If it's schizophrenic that you're working with,
yeah.
we get you to where you need to be. We don't just see black people,
Correct.
we go see people who need a service that nobody else wants to
Yeah.
see. And patients are mostly people that everybody else have kicked out or
Mhm.
pushed aside.
Mm-hmm.
We go in the woods and get people,
They feel welcome.
we feed them, we give them toothbrush, soap, clothing, food.
Just sit with them.
Yeah, sometimes just sit with them and listen to them talk and, give them a place to come and sit. We're a non-traditional doctor office.
Mm-hmm.
And people respond.
Yep.
Oh, yeah, of course.
We're going to
They're
dope
not
house.
judged.
Yeah, we're going to dope house.
Nice.
And you know, Maserati has walks for pancreatic cancer, they have walks for lupus,
Mhm.
they have walks for sickle cell.
Mhm.
And so during that time, we can have a walk here,
Yeah.
but at the same time, recognizing
And
the
I
same
was-
conditions.
I was gonna say, we're partnered with a Moffitt Center, and
Oh.
we're actually in discussions of doing something for the Great American Smokeout.
Oh,
But they have a mobile mammogram bus.
Oh, really?
Yeah, I was just at an event last month
Mhm.
where they were doing free mammograms for anybody uninsured.
Yeah, they come.
As long
They
as you
can-
were,
yeah, I
I
saw
think it was like
something.
Yeah.
35 and up, so they do it even
Okay.
earlier than what's normally traditionally done. And they didn't turn anyone away. They were doing mammograms all day long.
Okay. This has been so lovely. Thank you all for your responses. Please give Miss Aleacia another hand. Williams for her presentation. Thank you all. I'm gonna prepare lunch. There were a few people that came in later. You didn't get away. Introduce yourselves. I'm gonna begin to bring that out, and if anybody in here lays upon your heart to say grace, after the introductions, we'll do grace and then lunch, and we can still talk. Okay. So, we'll start here.
Start with me.
Yes.
I apologize for being late. I had a meeting at 10
No, no
o'clock.
worries.
I'm Susan Neff. I'm the Associate Director of Community Collaboration with Metropolitan Ministries.
Oh, okay.
The short term of that is Neighbor Hope, which we have a partnership with the with the community center here. So we provide rental assistance, mortgage assistance, utility assistance, case management, and community capacity building, I guess would be the easiest way to say it, for 34669 and 34610. Other things that we do is we have lots of resources available, like what Metro does, we kind of try to bring it out here. So we have diapers and formula and baby food, and sometimes we'll get, like when you say you go out to the woods, if you ever wanted to take stuff like some socks and things like that, if you had somebody that needed that, we have that capacity to bring that and to partner with people to do that kind of stuff out in this area. So, yeah. And I'm on the email that came through, but also you can just reach out to me here, and I can give you a card or something. I didn't come prepared at all because I was rushing around, doing all kinds of stuff.
Right, we had a tour.
We did.
Yeah,
In fact,
Mark and
here's
Manny
mine.
gave me a tour. I don't know if anyone wants to do a tour of right over
Yeah.
here.
Yeah,
You can
and
get
if you
an
need more
idea.
information about what we're doing, and I really appreciate what you said about, because I've been under a lot of stress because of the hurricane.
Mm-hmm.
And I've been healthy as a horse my entire life, but in the last 6 months, I have now on 5 different medications for all of those stress-related things. All of, every single one of them. I'm on high blood pressure, I'm on the A1C stuff, I'm on the cholesterol stuff, I'm on the something for anxiety, I know, all of it, boom, all at one time. Stress does that,
It does.
and it does that, yeah, absolutely. And it's so clear, and I can't take the stress away.
No, you can't.
No, I can't.
Well,
It's a way.
I know, there is a way.
there's
I have to
definitely a way.
humble myself.
Well, no, meditation, you have meditation.
Yes.
You have meditation, you have talking,
Yeah.
talking it out,
Yeah.
talking it out.
Talking it out.
Setting
boundaries.
that release, setting
Setting
boundaries.
Yeah,
Okay.
there are, you're right, there are.
And you know what I used to do, when I worked and I was really,
Yeah.
when I was working and I was really busy, my calendar, you didn't have the phone calendar then, but when
Yeah.
I had the big calendar, I would make up a meeting time.
Yep.
Which was my me time,
Absolutely.
Yes.
but it was like meet with
That's a
Mary,
great idea.
Mary Jane.
Yeah.
And then when somebody said, can you meet me at 10 o'clock? No, I have a meeting at the.
Exactly.
And that was my
That's
time.
beautiful. That's
You know?
Never thought about that.
Yeah.
That's beautiful. That's
I appreciate that, thank
Yeah.
you, that's a really good suggestion, and
Yeah.
you're right, there are things that I can't,
Yeah, you have to.
yeah, it's,
I think my biggest stressor is not work, because I enjoy work. I'm a great grandma of 4.
Ooh.
I'm a grandmother of 16.
oh, yeah.
And the grandkids on my nerves more than my kids. And so I saw myself being more stressed because of those grandkids, and I said, enough of that.
I know you
Y'all on
cannot
my nerves,
say
I'm done.
Yeah.
Leave me alone.
Take care of yourself.
Yeah, I have to step back from them,
Well,
because it's like,
that's what I was gonna say, we have to learn how to say no.
oh, I had to learn that.
Boundaries. Yeah.
And the
That's
first
the
time you
boundaries.
do it, it's the hardest.
Yeah.
But after that,
Yeah. It gets
easier.
easier.
Yeah.
I heard a really interesting statement a while ago, and I was like, I'm adapting to this one, I'm gonna shift it, because I used to be very much, I pour into your cup, right? I'm always pour into your cup, but when I need replenishing,
It's
everybody got empty cups.
Yeah, and
So I have shifted to, I'm gonna pour into my cup, and everyone else will get the overflow.
Yes.
hello.
Yes.
Cause I'm gonna make sure I'm in abundance, because I can't give if I'm not.
You
right?
can't be for anybody else. if you're
So
not.
I give the overflow now.
Yeah,
I like that.
yeah, that's
Yeah.
where I'm living now.
Okay. I'm gonna stand up though, because I like to stand up when I talk. And I'll keep it quiet, I'll keep it quick, quiet, very quick. First of all, thank you Candace for inviting me, because I come to all her stuff, it's awesome.
Yes.
My name is Chris Mahan, and I've been working in the community here for the last 10 years. I have a podcast called Lead Your Teen, it's on Spotify. I've got books on parenting, so maybe I can help the grandma here. But my thing is, here in Pasco County, in the area, I started a nonprofit years ago, which is closed now, but it was for teen suicide. And so I did it to combat teen suicides. That led to my former job, so that's what kind of got me working with young people. I worked in film for 25 years, it was like a whole new change. So for the last 10 years, I've been working in the community trying to help parents and more importantly, lead parents to know how to deal with today's issues with kids.
Yes.
And as I'm hearing all this stuff about health, which is awesome, one of the things that I really push is childhood obesity, the awareness of childhood obesity. It affects all ages, it affects all ethnicities, there's no one over the, well, some have higher, but childhood obesity is probably one of the biggest things that hurts our young people, which are our next generation. Whether it's the cortisol, whether it's the high blood pressure, whether it's the heart disease, diabetes, whatever it is, bone and hip issues, they are having adult illnesses at very, very young ages, which I think is horrible, which does come back to food, nutrition, healthcare, things like that. So that's what my big push is being aware that a kid isn't fluffy, they are overweight, and what does that do? That causes them to have mental health issues because of self-esteem, or they're being bullied or picked on, or they can't move, so they turn to more food, so it's a really bad vicious cycle that they get into, and then all the physical things happen. Which is the diabetes and the kidneys and all that type of stuff. So what I love hearing what you guys are saying, but I would love to maybe see something on the obesity problem, because it does lead to so many other things. And a lot of that does start with the mental, because they feel depressed when they start eating, so food becomes their friend. Then they become isolated because they sit in the video games, whatever, so now they're becoming depressed because no one wants to be around. So it's a really, really bad cycle that they get into at younger and younger ages. And because suicide was my biggest push years ago, we're seeing, even since COVID, a rise of over 147% for girls like 14 to 17. Guys, it's on the rise as well. So these are things that I think, well, what you guys are doing is great. But I think if we can also touch on, you know, why are kids self-harming? Why are kids wanting to kill themselves at 10, 11, 12? Why are kids wanting to, why are they so angry that they want to hurt other people? You know, I read this morning the 16-year-old that took the life of the other 16-year-old in Hernando a few weeks ago. He's 16 years old. Horrible all the way around. The case in Texas, horrible all the way around. This is, they're 16, 17, 15, they're doing horrible. Why? What's going on? So these are things too we gotta look at, not just the physical health, but the emotional health. Monday the 21st, I was supposed to get recertified as a youth mental health first aid, but it got canceled. It was through ASAP and Baycare. So Chrissy Paris runs that, but she had a family emergency canceled. So there are free classes that we can take right here to understand what's going on with young people. And then from there, you can know how to talk to them about HIV, talk to them about their health, talk to them about different things. Because they are in a real different world today than they were. I graduated in 1986, so it's a long time ago. Things are a lot different. Parents are different, and more grandparents are in charge of younger people. They're thinking it's 1980, 1970, but it's today. They're like, it didn't work. It doesn't. So there's a lot of things that we all need to work on for mental health, cortisol, exercise. I went to the gym this morning. If I can do it, you can do it. Go to the gym, go for a walk, do what you gotta do. I go 4 times a week. You gotta, you know, the older we get, it's more important still, because we have all these other stressors. And you can go in there and work out, and you feel great, you feel good about yourself, and you can really take on the day. So these are things that we can all do, which are amazing. I think you guys are doing great, and I'm gonna talk about this on my podcast, it's different things, so I want some of your stats. Yes, ma'am.
What's the podcast?
Lead your team. It's on
We have an
Spotify.
episode, Macca is mentioned
Yeah, we did
together. Macca's in his
about a
book
year and a half ago.
mentioned.
Yes, I've interviewed guests for my book. The book is being recorded now for Audible. It's called Parental Leadership: 7 Principles to Lead Your Teen in Digital Age. I'll show you guys all a picture of the cover. That'll be on Audible probably within a month and a half. My guy in California is recording it. I'm not doing it because he's recording it, editing it, everything. I just hear him do it. I launched the book 2 years ago, had a bad publisher, didn't like the cover, so I'm adding new stuff to it, new interviews, some updates on some things, some cases that I was covering, the school shooter in Michigan and Georgia. I'm adding some things, what's happening to parents, why they don't, you know, somebody said, I think I heard, I don't know if it was here, maybe today, that you have to really understand what's going on with your kid. And, you know, on the health side, that's very important, but on the mental health side, it's even more important. Because our kids are falling prey to all these things in schools, social media, movies, music, peer pressure, growing up, all this stuff. And how do they put it all together? They don't know. And that's when we have school shooters, and we have kids that self-harm, and all these other things. So as an organization, as a group, as adult leaders in the community, which is what I really push, you guys are doing a great job, which thank you for always inviting me. And I love seeing what you guys are doing and talking about and different things. More people, we should have a packed room right now.
Yeah.
We should have a packed room, it should be standing room only.
Yeah.
I've been fighting this fight for 10 years. People don't want to hear the truth. Okay, they really don't, especially parents. But we gotta keep pushing.
Yes.
You can't stop and just go 5 people showed up or 2 people showed up, because maybe that's a change.
Right.
So what you guys are doing is great, and I was late because I got caught up in the school
Yeah.
thing. Where's I going? So I asked somebody that I was like outside of parents, I'm walking around, so I kept, so anyway, I'm here. Yes, ma'am.
What's your name again?
Chris Mahan.
Okay.
M-A-H-A-M.
And Mr. Chris, what's the
M-A-H-A-M.
podcast?
Lead
Your team?
your teen as a teenager.
Oh, team.
Teen. Yes, teen.
So I just
T-E-N.
Google that?
You can Google it, it's on Spotify. There's a YouTube channel.
And I can send you all links.
Teen, yes, T-E-N.
I'll put his links in the follow-up email to
Yes,
everybody.
and I need,
Yeah.
I need subscribers, and there's no cost, so I need people to listen, to get things
Yeah.
and share, because I research everything. I just did some amazing interviews for the book. I have a guy in there, 50-some years old. He was a childhood sexual abuse survivor from Puerto Rico, and he wrote a book on how that's kind of not talked about, so the whole thing on him. You know, I got a young lady, and her mom just interviewed. She's in a wheelchair, cerebral palsy. She's traveled the world, doesn't give up. It's just, I try and bring not just information, but like good things as well.
Right.
We touch a little bit on generational things. I, in my humble opinion, I do feel that some of the disparities in regards to that is generational for us, where we grew up in food deserts, right, and or in neighborhoods where you might not find a Whole Foods, but you'll find a liquor store on every corner.
Yeah.
Right.
So
Yeah.
when we talk about addressing those things directly with our kids, we do, I think, also need to wrap around the family and have an understanding of what resources they have available to them, because we've all been probably poor at one point. We know the struggle, we know what the choices that we have to make, and it's not always good ones.
Yeah.
And so just keeping in mind that it's the whole family unit that we need to support as best we can too.
So this podcast, is it for adults or?
It's for parents, but anybody can listen to it.
Yeah.
There's
Well, do
nothing
you
good-
do anything for youth where they can talk back and hear stuff so they can
Interact
understand?
with it.
I have not done I tried to do a live on YouTube, but no one showed up. I did it actually on the Psychology of School Shooter. I was doing 8 episodes. I did 4. I have 2 counselors and 2 on myself. I tried to get some law enforcement to talk about the cases and what to do. No one wants to talk about it. It's like years ago when I had the suicide, the schools wouldn't even let me in because they're afraid if you talk about. So as hard as we need to push this stuff to educate people, there's also barriers of people saying, well, we don't want the liability in case something happens.
Right.
Oh, you brought this group in to talk about teen suicide, and then this girl killed herself, and now they're getting sued.
Yeah.
So it's all about the legality and the lawsuit
Well, it's
possibility.
sort of like condoms. If we come into the church and talk about condoms.
Now you're promoting sex.
Right.
So I've heard no.
Right.
Well,
At
I'm
the same-
just thinking that maybe we should
I would love to do a live. You guys ever
start
want to set
a
one up?
team.
Yes.
It's all on Zoom. We can do it live. I can do it before 9 people. We can get in there. We can record it.
What's
we can put it back out.
I'm just thinking that, like my soon-to-be 16-year-old, she's out there angry.
Yeah.
She's angry that her mom left her. Well,
I deal with
she
this
don't
all
know
the
her
time.
mom.
This is what I deal with.
And
Family, I
the
deal with all the
daddy.
time.
And I'm like, you know what? When we grew up, if somebody took you in, we were just happy. They on the street. What is wrong with you? You've never had to suffer for anything. I mean, she's just out there. She told me the other day, I'm just not gonna talk because I don't wanna hit you. I don't want you to hit me either, girl. No, somebody going to jail or let's
One or the
be
other.
Let's be
So-
for real here. Get that thought out of your mind.
So this is what I deal with. I
You know.
deal with the anger. I deal with these kids. That
Yeah.
are, and so a lot of it goes back to when did she become angry? What happened? Was she 8, 9, 10? Was there a life
Yeah.
change, family change?
Yeah.
So in my book, I have a 20-year parenting plan. My whole premise, I have leaders and managers. It's a business type mindset for parenting. So just like in a business, you have a business plan. Every 5 years, you want to look at it. Third year, are we on track? Are we making a profit? Are we going bankrupt? What are we doing? Well, families need to do the same thing. Is there a family change? Was there a divorce? Was there a move? Was there something that happened? Loss of work? Was there some type of dynamic in the family that changed that could affect everybody's viewpoint of everything? And how do we deal with that?
She's been with me since she was 4 days old.
Wow.
Mom had her in prison.
So there's issues right there. She's
it
probably,
is.
you know.
Dealing with
I've gone to the youth jails. I've talked to those kids in jail.
No.
And
Her mother.
I understand, but I'm saying, but typically
Oh,
when
yes.
these kids are angry, they turn to drugs. They
Crazy.
turn to
Yeah,
other
she's
people.
there.
They
She's
turn